Welcome back. Well, there's a new move to help improve the physical and emotional health of mothers in childbirth, and it involves a generous gift of $150,000, and it's for the Community Health and Social Service Center in Southwest Detroit, also known as CHAS. And the goal is to launch what's known as a doula program in the community. And joining us this morning is Dr. Felix Valbuena Jr., the CEO of CHAS. And Doctor, thank you so much for being with us this morning. I want to talk about how great this program is, but first, can you tell us about what a doula actually is and what a doula does? So maybe some of our viewers who haven't either heard of it or just they're unsure of what a doula does. Can we talk about that?
Sure. Good morning, Kevin. Thank you for having me. A doula is a trained professional who provides physical and emotional and informational support to the client or the patient. This is before, during, and shortly after childbirth, and helps them achieve the healthiest and most satisfying experience possible. So significant support, both physical and emotional, for mom, baby, and actually the whole family.
And so now let's talk about CHAS and the program. Can you tell us just a little bit about the program and the important work that you do in the community?
Sure. So CHAS is a community health center. We're in our 53rd year of providing comprehensive primary care to the community. It doesn't just include doctors. We have family physicians, we have nurse practitioners, we have dentists in-house, an in-house pharmacy. We've integrated behavioral health and community health workers, which the doulas fall under. They're specialized community health workers to try and help, as a collaborative group, provide the best care and support to the community that we serve. We serve about 10,000 individuals a year, and we are working to improve the quality of life of those that come to see us, and it's through comprehensive set of services that we're able to provide, not just medical.
I mean, 10,000. That is such a big impact to the community. I want to talk more about that too in a moment. But let's talk about the generous gift here, $150,000. Where did that come from?
We are honored to be a recipient of the Shostak Brothers and Company Community Giving Campaign. We were floored when we were informed that we were a recipient. And, you know, we had this doula program sometime in the past and we're not able to keep it up through a grant that we received. Now we have a plan put in place to revive this program, which we know provides a significant benefit to the community. And the Shostak Brothers and Company really came through and helped us to get this going again. So we're very excited about it.
So what would you tell people if, I mean, expecting mothers, you know, and fathers too, trying to plan, maybe they're unsure if they want to get a doula. What would you say to those people? And what are, maybe just to go into more detail about some of the benefits that it provides?
Yeah, the more support you have during this very important time, it's a life-changing event in the family, whether it's the first baby or the second or the third. And so the more support you have to get through the prenatal period, through the actual birth and into the postnatal period, I think the better outcomes everybody's going to have, not just mom and baby, but the whole family. And research shows that community health workers, whether it's in chronic disease or in prenatal care or pregnancy through the doulas, makes a difference. Really helps individuals to have better outcomes, both physically and emotionally.
And postpartum too. I mean, I remember my wife got home, or when we left the hospital, we're like, our first kid, they just said, "Here you go, you're out," and you're like, "Whoa, I have so many more questions." And so that's fantastic that you can get you know, help and support along the way afterward, and that's a crazy emotional journey afterward too of taking care of your newborn. I know we're running out of time here, but real quickly, can you tell us the launch date of the program and where people can go for more information?
Yeah, so we're in the process now of hiring individuals that are going to serve as the doulas. We have the training program set to go, and so early in the fall, we're expecting to be able to help our over 400 women that come through here a year that are pregnant in support throughout the pregnancy and post.
All right, Dr. Felix Valbuena Jr., thank you so much for your time this morning. We really appreciate it.